Okay, hi everyone. I'm going to cover the 13.1 Health and Media chapter slides. So if you want to follow along with the slides, great. If not, you can just watch the lecture and that is great too. So we're going to cover health and media today. That's what we're going to start with, or well, do for this entire video. So to start with, let's talk about the update on flavored e-cigarette bans. So we know that recently vaping on campus, jewel pods, things like that. FDA had banned the sale of e-cigarettes in September. And so back in November, again, the slides are a little bit dated because I had to switch quickly to what Dr. Totske had done. So reported back in November, the ban is no longer happening. So this is a big thing because we're talking about e-cigarettes, which prior to all of this, we had no clue the health risks besides lung cancer and stuff. Like there wasn't a lot of studies done. But it was reported back in November that the ban was no longer happening. So it was to be signed into a bill or into law by President Trump on November 5th. But, what else was going on? So what else made people start to quit? Right? So there's no longer this ban. However, people are still on their own, sorry about that, starting to quit. Let me see if I can make this a little higher. Okay, that's a little bit better. All right, so what is going on? All right, so with these flavored e-cigarettes, there's a lot of talk about, what is causing people to quit? Is it the health outcomes? Is it the risks? What's going on with these that might make people want to quit smoking them? And so that's just kind of a taste of what being a health comm scholar or being in the field of public health is all about, and studying like what makes people want to quit these things. So moving forward, talking about breakfast cereal. What do we know about breakfast cereal? What do we know about cereal? What do we know about breakfast? And then what do we see on the news or the television or whatever it may be, YouTube advertisements for breakfast? I mean, you could probably think of at least 3 breakfast cereal commercials. My first initial thought when you talk about breakfast cereal is Cinnamon Toast Crunch and the cannibalism that goes on in those commercials, right? So these health and media commercials really play a difference. And there are people who study what's going on, not only in these commercials, but what's going on health-wise based on these products. So media shapes how we think of different products. And this happens from a young age. So there are countless messages and images that we see across various channels. So we've got TV, video, streaming. Think about commercials and programs. Social media, think about all the ads that you see. I don't know how many times in this quarantine I have literally wanted to buy something online because I saw it in an ad. I almost bought a freaking jumpsuit the other day. Do I need a jumpsuit? No. But I saw one online and I was like, I should buy it. So social media influences a lot too. Not that that was health related, but you understand. Podcasts. If you listen to podcasts, some of them have commercials before or in the middle or sometimes throughout or at the end. So those can make a difference. Posters, billboards on Mile Ground Road, you will see, well, I don't know if it's there now, but before there was a billboard that said, West Virginia, this bud's for you. It was specific to the state of West Virginia, but really, if you're driving and you see that, you're like, I'm in West Virginia. It must be in Morgantown because this bud is for me, right? That makes a difference. And then there's also interpersonal communication about topics and media messages. How many times do you see something and you go talk to your friends about it or your mom about it? I've seen several advertisements and I'm like, hey, I've been seeing this a lot. Like, I don't know, maybe it's a product that your friend has brought up and you're like, maybe you should try it. Sorry about that. Right? So there's lots of ways that the media shapes how we think about things. Um, and our priorities, our interests are really shaped by what we see and what we consume, right? So we see these messages in the media and then we buy them or we use those products. I have one of those Quip toothbrushes. I don't even know that I like it, but I saw enough media messages about it that I was like, I'm going to buy this. So I bought it. I mean, I use it, but I don't use the fact that it's an electric toothbrush, basically. I use it as a manual. And so, what we think affects the rest of the world is shaped by media, right? So, we often talk about, like, my friends would be influenced by this, but I wouldn't be influenced, right? This is the third person effect. We think the world is often very heavily influenced by media, and we are often not impacted by that, or that's what we perceive anyway, right? But what we think actually affects these products and these commercials. So when you like an ad on Instagram, that affects their campaigns, their targeting, and that, because we saw enough of it in media, that impacts us and we impact the rest of the world. So what we find to be normal on any aspect, any consumer aspect. So, what we think is normal, what we should buy, what we should look for online, how should we act? This is often taken from the media, and we go to entertainment forms of media. So, Netflix, Hulu, social media, we go to that for our entertainment and learning. Just thinking about it right now, Tiger King. Tiger King is huge in America. If you haven't seen it, you should watch it. It's the craziest stuff you will ever see. It's literally crazy. I just finished it today. We see that and we're like, wow, this is crazy. This is not normal, right? But our perception of normal has been influenced by the media. Okay, so that's how it impacts us. So this next slide talks about, of these, what do you think the leading causes of death are in the US? If you go to the slide after that, you can see heart disease, cancer, accidents, RD, stroke, diabetes, overdose, flu, guns, shark attacks, right? So heart disease is the leading cause of death in the US every year. But is that something that we would have thought about before, right? We see all these movies like Jaws that portray shark attacks as so fatal and so very powerful in creating deaths, right? But really, there's less than 100 shark attacks each year. But our media shapes the way we think. So think about that when you're, wondering about deaths in the US based on health related things. Or think about that when you're just thinking about, how might the media have a hold on me? There are two main frameworks that we talk about, the first being cultivation theory and the second being agenda setting theory. So we're going to go ahead and dive right into cultivation theory. So the more media you consume, the more your beliefs or view of the world is going to be consistent with media narratives, right? So by watching hours and hours and hours and hours and hours of TV, your worldview, your beliefs begin to reflect the media narratives, right? So health beliefs, I'm so sorry, reflect the health images in media the more that you view it, right? So we have a more positive view towards fast food. It's okay, I just gotta get a quick meal. It's just a breakfast burrito, we're fine. The higher the belief that you have about crime in your own community, And then finally, there are implicit images and messages about body size. So the more media we consume, the more we think that we should be a size 0, or men should have muscles, men should have, or should be able to lift heavy objects with ease, right? Women should have the peach booty, right? Like the emoji, right? That's how we are influenced. That's what influences us. So it's especially impactful when, one, images are very consistent. So things that we see over and over and over again. Two, there is a high exposure. And then three, there is a limited ability to evaluate what is seen and heard, right? So we see these commercials over and over and over again. I'm watching Netflix or Hulu. Hulu would be a better option here because they have commercials. So I'm watching Hulu. And then there's also this limited ability to evaluate what is seen or what is heard. I'm not thinking about commercials often after the time that they're done. I don't know why I can't speak today. I'm so sorry about that. So there's a limited ability to evaluate, right? The commercials are over in 80 seconds, and then my show comes back on, and that's what I focus on, right? So this is especially impactful for cultivation theory. News and social media can shape our health beliefs as well. So influencers, we've seen those influencers that share their tummy teas or diet advice, or, I couldn't get the body I have without the help of Jessica or whoever it is, right? We see these influencers and the things that they're sharing aren't necessarily true. You get people who sell it works and they're like, you're going to lose so much weight. Take these 2 pills a day for 90 days. Doesn't make you lose weight. It's not FDA approved, right? So back to the first example, news on e-cigarettes. So they are across media outlets, apps, channels. So Snapchat news, Snapchats from your friends, advertisements. Those shape our health beliefs as well. There are several commercials and things out about e-cigarettes that tell you, no, it is bad for you. It's not like it was previously thought, but smoking e-cigarettes can cause just as much damage. But we see everybody on social media doing it, so why wouldn't we? Agenda setting theory is the content that is covered by the media, shapes the relative importance, okay? So it doesn't accurately reflect reality, but the media filters and shapes what information we receive. So you can go to any news outlet and you realize that there's a bias based on political affiliation, right? If you haven't, well, now you do. So we see only what Fox is showing us, or only what CNN wants us to see. And the more something is covered in the media, the more that we think it is likely to occur. But does more attention mean more importance? So the availability heuristic means that the easier something comes to mind, the more importance we give it. So we see Jessica's workout plan all the time in media, or trying to think, in the news, especially around election years. You see a lot of things either for or against certain candidates based on the political affiliation. So if you primarily watch Fox, you're going to see more on those candidates that they choose to report on. But does that mean it's more important? Well, with the availability heuristic, we often think that the more I see it, the more important it is. I'm going to make it seem more important. So in health contexts, we see a health risk or an issue in the media. That means that the more we see it, the more we're going to think it affects us. So the less we see something in the media, we're not really going to think about it as much. And this does affect individual decision making, which can also impact policymaker priorities, right? So it's not just about getting you to buy a product or do a certain health behavior. It's also about what policies are going to go into effect. When we were still in class, this is why I talk about make sure you know what these candidates are in the upcoming election, right? Because if they have a bad plan, but we're not seeing it as such because we're not paying attention, and we're paying attention to, other media outlets or the same media outlet, that's going to influence us, which then in turn influences our policymakers' priorities. Okay. Health and media moving forward, there are various ways to approach the media impact on health. So thinking about these things, how does media use affect our health, right? So how does sitting on your couch and watching Netflix impact your health on a day-to-day basis? Also thinking about the messages that are out there and how they are going to affect us. What strategic programs are in place to influence us? So the government campaigns that are used to educate us, that are used to change our opinions, especially with this being a campaign year. Think about the health um, commercials you see from candidates. Think about nonprofit or advocacy campaigns, direct to consumer advertising. So things that they just automatically put these health supplements, I guess would be the correct term, on commercials. And they say, check with your doctor first, right? How can we use media to change others? If you take COMM309, you will talk about this later. So pre-1980s, this is direct-to-consumer advertisements. Big pharma and pharmaceuticals only advertised to the doctors. They did not advertise to the general public through commercials, but the markets were changing. So companies came out with generic versions of the drugs. There was a high competition to sell your drug, and there were fewer huge breakthroughs, right? So it's not one of those things that we've got a miracle drug for this, right? It was, I have a generic of the EpiPen, buy mine because you're going to save money with it, right? So the marketing was changing. There was pressure to reduce the costs, and this did include marketing costs, right? So it wasn't just we have to reduce the costs of drugs. We have to reduce marketing ploys, right? We can't just keep going door to door and hope that we sell something to these doctors. Pre-1980s, Americans had been losing trust in physicians, and there was a call for more patient control. Patients wanted to know what was going on, what they were taking, and how often they should be taking it. So they were looking for a new angle. In 1985, the FDA claimed regulatory oversight of direct-to-consumer advertising, right? So there are strict guidelines on product labeling, but there's less strict on advertising. Ads don't have to have pre-approval before airing, right? So with product labeling, you have to have all the side effects, all the things people should be worried about on the bottle. However, in advertisements, not pre-1985, but 1985, you didn't have to do that. They didn't have to have the pre-approval. So in 1997, there was a further reduction in regulation of direct-to-consumer ads. You could provide incomplete information as long as you told people where to follow up. Now, let me bring this to a question really quick. And again, I know this is rhetorical because this is a video. But if I tell you, this drug is going to make your hair grow longer, it's going to make you lose weight, it's going to make you more attractive, it's going to make you healthier, whatever it is, I don't give you any of the side effects. I just say, for more information, go to www.kyliesmiracledrug.com or .org, whatever it would be, right? In 97, and that wasn't that long ago, so 22, 23 years ago, in 1997, as long as you provided where people could follow up at, you did not have to give them all the information about side effects or potential harms. So the FDA started to focus on two issues relating to direct-to-consumer advertising. First, adequate information must be presented in a manner that is comprehensible to the average consumer. So I can't just go in and tell you all these side effects with these major medical terms. I had to make sure that the message I was providing was something that you could comprehend or the average consumer could comprehend. And complying with the fair balance principle, um, this called for a balanced presentations of risks and benefits. I can't tell you all these wonderful things that happen without providing some of the risks that could happen as well, right? It had to be balanced. Some of the proponents of pros and cons of direct-to-consumer advertising. This helps consumers make these informed decisions. They're getting risks and benefits. Because they have this information on these benefits, they're able to make these informed decisions. And it informs of alternate treatment options. There are several times, I'm sure you've experienced it yourself, where you go to the doctor and people say, you're going to take this medicine. I know I use blood clots a lot, and I'm terribly sorry, but it's really the only health issue I know anything about right now. I went to the doctor, and my doctor said, hey, you're going on Eliquis. Cool. What's that mean? Right? I didn't have any sort of alternative for treatment options. Now, had I saw a consumer advertisement that was on TV, I might say, well, I don't know if Eliquis is right for me, right? Maybe I should try X. Okay. So it did provide that alternate. But there are some critiques as well. So there's sufficient information about costs of these alternatives, um, insufficient information about alternative treatment options. So you see the direct consumer advertising, and it's only about this one type of medication, right? You're not going to see any sort of advertisement that is going to say anything like, try this drug, but if you don't like this one, try this one, right? They're not going to be in the same advertisement, right? And there's not a lot of information about side effects. If it is presented, it is presented very quickly, and it's not very easy to understand. So this often confuses and misleads consumers. It also interferes with this physician-patient relationship. Not saying that you should think that you know more than your doctor, but if you come in and you say, I know this drug I want to use, or I know of this treatment plan, it might come across that you know more than your doctor, when in reality, you don't. And so that's going to interfere with this relationship that you experience. It's going to be harder to focus on the element of trust. And this does stimulate unnecessary demand for drugs. So, this starts to make people want brand name drugs over generic drugs. It leads to inappropriate prescription drug use, and it could increase costs via unnecessary prescribing of the high cost drugs, right? So you see, now we don't see them as much anymore, but there used to be advertisements when OxyContin was new. It is a brand name drug. Percocet, Vicodin, right? We know these drugs. We know they're out there. And this direct-to-consumer advertising really stimulated the unnecessary demand. I don't want the generic. Now, generic is supposed to use the same ingredients. It might have differing levels, and that's how they can get away with being generic, but it's supposed to be relatively the same. But people didn't want that. They wanted the name brand drugs. So, types of direct-to-consumer ads, there were three main types. The first being the reminder, second, help seeking, and third, product claim. So, reminder, this is the name of the drug and very limited information, right? So, you see in the slides this ad that's next to it. The first line says, ask your doctor about, and the second line says, arbitrary. There are no other claims about the product. There's no other information besides ask your doctor about and the name of the drug. So there's no other claims. It also reinforces name and brand loyalty, right? So this promotes information seeking with that brand. By only showing the brand, you're not looking for other drugs that do the same thing. You're looking for that brand. So you want to seek information on it. And then it doesn't contain any risk information. This creates a problem because if you don't know the risks, but you become loyal to this brand, then what are you getting yourself into? You may not really know. The product claim. This targets a specific prescription drug. You can watch the YouTube video that is in the link next to that. It has to contain safety and efficacy information, meaning I have to tell you the side effects and the benefits and the harms. I have to tell you all this information. And talk to your doctor if you think that this might be right for you. I've got to tell you if it's something that you have to take daily, weekly, if it's something you have to take hourly. I have to tell you your efficacy information. And the regulations require that these comply with adequate provision and fair balance principles from the FDA, right? So I can't just tell you all these great benefits and leave out the risks. I need to include both. With product claim, there are various requirements from the FDA, the first being the major statement. So what is the most important risk, right? Risk of death. That's one we hear a lot as a major statement. Brief summary. Side effects, who shouldn't use it and how effective it is, right? So side effects, you might experience drowsiness, you might experience dry mouth, you might experience hair loss, whatever these side effects are. Who shouldn't take it? Pregnant women, anyone under the age of 40, right? It's going to tell you who should not use it. And if you take this, you could be clear within 4 weeks. Okay, so it has to provide a brief summary. There has to be an adequate provision as well. So what are all the risks? I have to provide a phone number, a website, or other sorts of information as to where you could go to find all of this information about this drug. Ooh, I just hiccuped and that hurt. And then the fair balance. So balance, it's not in, or it is in content. Oh man, I'm so sorry. I don't know why I have the hiccups right now or why they're hurting so bad. With balance, it has to be balancing content, not space. So it has to balance the risks and the benefits. If I'm telling you 4 benefits, I have to tell you the 4 risks. Or if there are only 3 risks, I can only tell you 3 benefits. I can't overload you with benefits or risks. And then finally, the help seeking. These are targeting consumers with particular symptoms, right? So if you have migraines, if you have this, if you have that, right? It encourages consultation seeking and discussion of treatment options. Talk to your doctor if you have X, right? It does not mention a particular product, and it is forbidden if a product is the only available treatment for a specific condition, symptom, or disease, right? So I can't just say, take whatever, I can't think of a drug name right now. Take this for this disease, right? I can't give you the name of it, but it also can't post that advertisement if it is the only product available. So it's pretty important to realize you're helping to provide information on who to talk to for this. It is generally not subject to FDA oversight though. Okay. With social media and direct-to-consumer advertising, I forgot what the C was for, I'm so sorry. The FDA guidelines are for print and broadcast. So social media platforms tend to have their own rules. They don't follow the FDA guidelines. An example is Instagram prohibits paid ads to market sale of prescription drugs. So on Instagram, you're not going to see a sale of prescription drugs in posts, even with the hashtag promotion, hashtag advertisement. hashtag paid ad, whatever it is, right? There are lots of help-seeking ads, but they typically refer to a website, right? So they're kind of getting away with maybe being able to market a specific drug. So in the next slide, these are some advertisements that you would see, and there is a link that you can follow in the notes section, so please follow that. So most push consumers to a service or product indirectly using social media. The purpose is you buy from them or at least bring it up with your provider, right? They want those sales. They want your business. They want you to talk about it, and then hopefully it's going to get some sort of money or profit for their company. And it does promote medical services and consultations remotely, right? That's not their main concern, but it does promote them. So there are some other types of health media. So there's an e-health, which is the use of technology to transcend geographical distance to promote health or wellness, right? So, websites that might promote health and wellness, apps, seeing things on social media, sharing things with others online. Many people are going to share their stories online, and this is to help others cope. But it's also to help you cope as well, right? So forums like WebMD or Reddit, Facebook pages, Twitter, Instagram followings can be devoted to illness experiences, sharing this information, and providing the social support that you might not get otherwise. So there are other health media such as mHealth, telehealth, or telemedicine. mHealth is using devices, smartphones, tablets, watches to manage health and wellness. So it's less about the communication aspect, but more about information and collection. It manages your own health by tracking lifestyle and nutrition measures. So thinking about anybody who has a Fitbit or the new Garmin watch, Michael Kors has a fitness watch out, an Apple Watch. Thinking about those. Apps like MyFitnessPal or calorie counters, right? Those are all mHealth. They don't care about communicating with you. It's about the information. How many hours did you stand? How many hours did you sleep? How restless were you last night? That is mHealth. Devices like fitness trackers, nutrition logs, and other measures of health information are on the rise. And some companies include these data to judge health insurance premiums, right? So there's several premiums out there that say if you are at or below a certain cholesterol index or BMI or whatever it might be, we can get you a lower premium, right? They use these health trackers, these nutrition logs to incentivize you and to help you in the long run. There's a large push to integrate these together with these big tech companies. But there's some controversy over what information can and should be measured. So for example, in women's health information like period tracking, it's completely left out of most trackers until very recently, and they're still not very popular, right? So that might be something that's very important to some people, right? Thinking about people who might have a hard time conceiving. You are using fitness trackers, nutrition logs, maybe some other forms of mHealth, right? You want to try and get pregnant, and maybe this hasn't happened to you yet, but having an app that has a period tracker, that might help when women try to get pregnant, ovulation logs, right? But that's only recently become a thing because it's only impacted women, or so to speak, right? Men aren't necessarily 100% into following women's periods or things like that, right? So it's been kind of controversial. Telehealth and telemedicine offer clinical services to patients remotely. So teleconferencing, phone calls, emails, messaging. They will share your diagnostic information with patients and providers, and it promotes providers. It includes providers consulting with each other to diagnose or treat. Okay, so we might see this a lot with the coronavirus right now. I know if you're going to get one of the coronavirus test kits, a lot of the time what they're doing is they do kind of a roadside, they will come to your car, swab you, and then leave, right? So you don't have to go in, you don't have to be around each other. WVU has an app called MyChart. This MyChart allows you to message people when you feel sick or have an appointment. It's become especially widespread as technology improves, more connectivity, higher speeds, there's more capacity for care at a distance. I don't know if any of y'all have used the Smile Direct Club. That is a telehealth, telemedicine health technology, right? So you're trying to straighten your teeth, whether for cosmetic reasons or, health reasons, but you do everything remotely. So you do the impressions yourself, and then you teleconference in with your doctor. Probably shouldn't do that though. They have come under fire recently about they're actually causing more harm in your teeth. They're causing more people to have crossbites, which are especially dangerous for your health. So maybe don't do Smile Direct Club. The uses and effectiveness of have affected or are affected by this digital divide. So not everybody has access to internet or data. Think about West Virginia. West Virginia, I mean, it's a food desert for sure, and that's one aspect of health, but thinking about internet access across the state, there are several locations that don't have good access. So thinking about Davis, West Virginia. Davis, West Virginia is about, I think, 2 hours from here. I might have the time off. I never really paid attention to how far away. But they've got a really good burrito place. So if you're ever in that area, go to Hellbender Burritos, I think is what it's called. They're not healthy, but really good nonetheless. But people in Davis don't have internet access. They don't have, smartphones that work with the technology. I'm not saying that nobody does, but the town as a whole, it's lacking. So geographic constraints, age constraints, racial ethnic divides, economic differences all impact this digital divide. About 25% of the US is without reliable broadband internet, and West Virginia is 47th out of 50 in digital connectivity, right? 30% in 2017 had no access. Some people are still relying on dial-up where you can't use the phone at the same time. I don't know if y'all were born to remember that or live in that era. It was terrible. The digital divide affects those who already lack access to medical care and makes it even harder for them. So there's an impact on rural care. Rural communities have more premature death from preventable diseases. There are fewer clinics, there are fewer providers, and there are fewer transportation options. Telehealth helps communicate, counsel, and monitor these chronic conditions. You can share your test results, you can refill medications, you can diagnose some conditions, and you can provide some advice. These are very helpful resources if you have the internet and broadband connectivity. This also allows for specialty services, so mental health care providers consulting with specialists. The options are especially limited outside population centers for patients and providers, however. So rural care, it's kind of hit or miss. Some communities have it and some communities don't, but it still can provide stigma-free or at least reduce stigma access. It does still rely on consistent internet access, however. The pros and cons of e-health, m-health, and telemedicine. So the advantage, it is a democratization of information. There are available resources on less known rare health conditions. There is a distribution of support systems, and it can increase patient engagement to improve their own health outcomes. However, there are several disadvantages as well. The first being lots of misinformation. It's very easy to misinterpret what somebody says online. There is conflicting information depending on the source, and the credibility varies depending on sources. There's a potential to disclose protected health information. So you might have to give information about yourself that you otherwise would not have to put online. And it can reinforce the haves versus the have-nots. So I have internet access. I have accessibility to my doctor. I don't have internet access. I do not have internet, or I do not have access to my physician. So big tech buying into healthcare. This is something that I kind of touched on earlier. Amazon has its own healthcare company. It is with JP Morgan Chase and Berkshire Hathaway. It has acquired an online pharmacy startup and houses EHR data for some companies. So Amazon has announced that a telemedicine service, so via the app and or the website, for its employees for now, but they're hoping to expand to the general public. The Echo, the little circle thing where you say, "Hey Alexa," and she listens to everything that you're saying. So you have to be careful what you're saying. The Echo might be able to measure breathing. This could be something for neonatal care, heart attacks, and people with chronic conditions. It can be a way to help manage that. Alexa might be able to detect when you're sick and offer medications. Talk about creepy. Like, you have this inanimate object, this robot that's in your house that's going to be like, "Hey, Kylie, you sound sick. Let me offer this medicine for you. We can put it in your cart on Amazon. We'll go ahead and just get it ordered for you and get it to your house." Still kind of creepy in my opinion. Some believe that clinics could open, maybe in Whole Foods, right? So big tech is buying into this healthcare. Apple facilitates research with health data from phones, devices, and watches, right? So it's this Apple Research Kit. So if you have an iPhone, you could literally go on your phone right now, and wherever you keep it, you can go to the search and type in health. And there is an app. Oh, okay, apparently mine has. There's an app, and I don't know if you can see it because of the glare and stuff. But it's this one right here. It's the white box with a little pink heart in it. And it'll tell you how many steps you've taken if you have your phone on you, how much you've moved, exercised, stood. Tells you highlights, right? They have this. They provide this research. And that's all just from carrying your phone with you. If you have that app, they have access to it. It tracks your heart rate in the Apple Watch, and the health app displays medical records from many hospitals. So Apple is trying to develop its own medical record system, and it has an on-site clinic, only for employees at the time, but it has its own clinic. So all this big tech is buying into healthcare. It's trying to get to know us better to make us healthier. That sounded very crazy. I didn't mean it like that, but you get what I'm saying. Google is another that's buying into healthcare. So they recently bought Fitbit, and they want to integrate it with mobile search app, data app, or mobile search and app data, and maybe Nest. So they want to host electronic record data for your health. And so it's going to be connected via smart operating rooms, these companies that have artificial intelligence to use health data, and then it'll be partnered with this virtual diabetes clinic or this virtual clinic. And there's a link in the notes section if you want to check this out. So with Google, They do Project Nightingale, which secretly collected patient records from Ascension without doctors and patients knowing to better, um, without them knowing, sorry. And this was done to better study or find patient data. There was a similar controversy with the University of Chicago Medical Group to protect patient outcomes, right? So Google is getting this information on your health, possibly, and you have no idea, your doctors have no idea, and there's already been controversies with this. So it's pretty important. So the big takeaways, when we see or hear consistent health-related messages, our health beliefs typically reflect them. And that is cultivation theory. Our health-related priorities or concerns reflect what we see and hear in the media, what is represented. That is agenda setting, okay? So there's loads of information available to everyone. Sometimes it's good, sometimes it's not. This is direct-to-consumer advertising. And technology can transform our care. Sometimes it can be really great to have that information on your watch or your phone or online patient records. I mean, coming here, and I didn't have a primary care physician until I got blood clots. So being able to electronically transfer my medical records, so nice. I could pull up everything and give it to my doctor right then and there. But it can also complicate it. If you don't have to, or if you don't have access to internet and you're already in a rural location, this can impact how often you actually go to the doctor, or your information is being stolen. So there are lots of big actors or big technology that are dealing in data. Some of them, we have knowledge about this, like Apple, we know that our health can be tracked. But did you know that Google is taking your information with Project Nightingale? Because I had no idea before, right? So there's a lot that we know about, and there's a lot that we don't know about, and technology really does transform this care. Obviously, the Your Experience paper, you do not have to do, but think about your media usage for health. What do you use? Why do you use it? When do you use it? How does it help you? How might it hurt you? Okay? Just some things to think about, for media and health. Okay. All right. Have a great night, and I won't see any of you during the next video, but you'll see me at the next video. All right. Bye.